Good afternoon. This is Kim Anderson for HIF 6010, and this is my presentation, assignment 3, on eHealth Exchange presentation. I thought we'd start out with a definition of what the eHealth Exchange is. And it is a rapidly growing network of exchange partners that securely share clinical information over the internet across the US using a standardized approach. This involves a common set of standards and specifications that enable the establishment of a secure, trusted, and interoperable connection among all participating organizations for the standardized flow of information. And that was from the eHealth Exchange website, and just kind of defining what they do. A little background, health information exchange definitely is key in advancing patient outcomes and promoting patient satisfaction and care. And it provides a state exchange, providing a state exchange, which includes quality measure reporting, is required to continue to advance these outcomes and to improve holistic patient care. So it's very valuable that we utilize this to the best of our capacity in the healthcare system in order to really improve on that patient care. And the eHealth Exchange is instrumental in providing a standardized approach to sharing important patient information to healthcare workers. And that is why it is very important that we adopt a state exchange so we can definitely improve on patient care, patient outcomes. And as a part of this, it really needs to include quality measure reporting. The system use must be universal and provide easy access across state lines. That is very important as our demographic, our society gets, we're more mobile, moving state to state. We need to make sure that that health information is following that patient in a really easy and accessible way so that they can have access, the healthcare providers have access to that so that there's more holistic care for the patient. We need to really make sure we have consistent and accessible technology from state to state. It needs to be very uniform. And like I said before, very accessible, regardless of whatever system you're working in. This would definitely improve equity, healthcare equity, by providing equal access to healthcare information. And that would be regardless of your social determinants of health. So would, in essence, kind of level that playing field for patients as well. So as I said before, it is crucial, I believe, that all of the United States participate in the eHealth Exchange. And I think a way to really encourage the participation is using incentives. I think incentives must be given to encourage involvement to securely share this clinical information. I think that's a good way, a really good way to get healthcare systems really invested and utilizing this system. Quality measures definitely should be reported to Medicare quality improvement organizations. Already, the eHealth Exchange has on their board, they have, Medicare is definitely involved in this process. And I think that's really important to continue that and improve on that also. And I think, a good way to tie in those quality measures is tying them into reimbursement for services that we already have put in place. How to fund the eHealth Exchange. And I think funding should come from multiple sources. I especially think it should come, it should come from federal and state levels. I think that, again, if hospital systems, would receive incentives to be a part of the system, I think that would be very motivating for systems to buy in and be a part of this. And then if they don't participate, they don't get those incentives. And so I think that would be a strong motivator to tie it into incentives. I also believe, tying this into Medicare and Medicaid reimbursement would be very motivational as well. In my past 30 years in healthcare, I've seen that, when reimbursement kind of gets tied into that Medicare and Medicaid, systems tend to really prioritize that and really try to step up measures so that they can get their systems in line with that form of reimbursement. And then just to follow up here is my reference I used for my slideshow. I definitely, as I said before, I strongly believe that, or strongly support that we need to adopt eHealth Exchange. And I think it will better our patient care. I think it will really help our providers also to, see the big picture of the patient, all the information, and have that information follow that patient from state to state, from system to system, so that we have that consistency and optimize the care for the patient. I thank you so much for your time. And please let me know if you have any questions. Thank you.